Namaste, I am Dr. Rajeshri from Radha's Ayurveda, Hyderabad. Uh, Hello. Our last session last week, we went through all the common disorders that we see. Hello, Rajanji. That we see in all the ladies, right from the puberty age, adolescent age, and then the entire reproductive age, and our ladies who have finished. Hello, Pankaj. Hello. Yeah. So we have seen all the disorders that ladies commonly face when they reach menopause. We have seen all the diseases exclusively in ladies from the childhood to the menopause age. So today we are going to talk about the very common problem faced by women during the reproductive age, the menstrual disorders. I mean, it could be either excessive bleeding, less bleeding. We'll talk about all those things. Let us start with, as I said in my previous session, I am going to use a few Sanskrit words, and I will also give the meanings to them. Because they are very essential in knowing the concepts of Ayurveda. Yeah, so hello Roshali. Yeah, so I would like to I hope I am so overwhelmed seeing this on live. Okay, I hope you're all having a good time with all our sessions going on every day since 2 weeks. This is the second week we have entered. Let us talk about menstrual disorders. This session, we will see the signs and symptoms which are taking place, I mean, in females, how you can identify them and when you should see a doctor, just like we have seen in the previous session. Let us start with 28th of May was the menstrual hygiene day. It was started from 2014. Mainly, it was marked to educate underprivileged girls to use sanitary napkins instead of cloths, and menstrual hygiene education and sanitation education. They have since then they have planned a lot of they have undertaken many initiatives to educating them and to providing many people with sanitary napkins and water facilities in many places. So today let us start with why sanitation and hygiene is important. We have seen increased number of cases of cancers. We will have lectures on cancers later on, but cervical cancer is one of the very predominant cancers all over India, I can say all over the world. So what the main cause, one of the very main causes is use of cloth, and many infections which are like torch infection is one of those which are identified directly during pregnancy and not known when it starts happening in the body. So using cloth during menstrual cycle is one of the main reasons. That is the reason why we doctors, the entire medical community, suggest the patients to use sanitary napkins which are hygienic, and also they are user it is easy to dispose them of. It is not very difficult to manage with them. So these are the myths which we have to burst in a few places where still there are girls who are using cloth. I would like to ask each one of my viewers to talk to the underprivileged girls who are probably the girls who are working at their houses or the girls of the maids, okay, and educate them about using sanitary pads in general. So right, thank you, Dr. Aditi. Yeah, that is about the menstrual hygiene day information. Thank you so much for that. Yeah, let us start talking about the menstrual disorders. I want to suggest I want to suggest, hi Manisha, I want to suggest all the mothers out there to educate your young girls. Before they reach puberty, they should know what the entire cycle is and how the reproductive system functions. They may not have a knowledge about hormones and what hormones do, but then they should know when the first puberty sets in, when the menarche sets in, they should not be scared of what is happening to them. So they should be prepared with it. They should know how to use what sanitary napkins could be used. They should have a knowledge of all these things. So I would suggest everyone, all the mothers who are watching out there, please educate your adolescent girls. And menarche starts at the age of, as per Ayurveda, at the age of 12 it starts. 12 to 14 is taken as a mark, but then it could start a little later. It all depends on the genetic and food they take, and ahara vihara, which we call in Ayurveda. It also depends on the entire family progeny, how it has always happened in their mothers and grandmothers. So after this, menstrual hygiene is important. First is you have to educate girls about proper disposal of pads, how they have to be disposed, because there are incinerators where separately they are separated, the pads are separated after disposal. So a red dot, there was a campaign going on in Pune a few years ago, where putting a red dot was the campaign, was the entire agenda behind the campaign. That is where it becomes easy for the garbage segregators to not use them for recycling. That is one thing which I wanted to highlight here. And the next thing is use of tampons and menstrual cups. The girls who are usually in sports, and also the girls who are they find it very convenient, who are on the go, they are very convenient with the menstrual cups and the tampons. I would like to advise them to first consult your doctor, and before that have a good guidance before using tampons and menstrual cups. Why? Because there are reported cases of shock setting in because of excessive time. The tampons and cups are just kept for a longer time, because of which infections come in, and then there are cases when girls have slipped into shock. So let us not complicate the situations, because menstrual hygiene is very important. So first educate yourself about its use, and then go forward, talk to your doctor, and then use it properly, nice with knowledge. Okay. And next thing is yeah, hello Samarth, hello Nishant, nice seeing you guys here after a very long time on my live, right? Yeah. So yeah, let me talk about do not use any chemical substances to clean your urinary area or the vaginal area. This is very strictly told. To some extent we can talk about using there is a vaginal wash kind of things, but then try avoiding them as much as possible. Only the ones which are safe, consult your doctor, and only then use which your doctor asks you to. And the best thing to do is use warm water or hot water. And we also advise Triphala Kashaya in Ayurveda, but there are conditions where that should be used and where it should not be used. For that as well, please talk to your doctor. And menstrual hygiene is important. Yeah, I would like to suggest all the and then let us talk about busting menstrual myths. In society today, even today in the society, this is considered a problem. I want to make it clear that this is not a problem. It is a physiological process which happens in every female, and it should be considered as a friend to us. which tells a female that yes, your hormones are good, you are doing well, and your health is really fine. If this is not happening, this physiological process is disturbed, it means your hormones are not fine and you should see a doctor. So don't consider it as a problem. See it as a physiological process and see that you follow all the instructions as per Ayurveda. Very important thing is we have 3 dosha: Vata, Pitta and Kapha. As per Ayurveda, you have to protect your Vata dosha because we spoke about it in the previous session as well, that Vata dosha is very much important for expulsion of fetus during pregnancy, and it is also important for entire well-being of a female. And for that reason, your food which you eat, and pitta also has to be balanced. That also is based on the food which you eat, is very essential in a female. You shouldn't take a lot of sour stuff, a lot of we call it tikshna ahara, which is a lot spicy. There is a limit to it. You limit it to some extent, but don't go to a very large. And then also what I covered in the previous talk about the junk food which girls today in our adolescent age are preferring. I advise, please, if you can avoid it, please avoid it, because there are many things joined to it which may happen in the body and which may cause some irregular periods and your hormonal disturbances. Let us avoid them and then adopt some good healthy lifestyle. Hormones are important. How do hormones function? Hormones are there is a hypothalamus, pituitary, ovarian axis, which is all interconnected with one another. One thing is generated and it triggers the other, and then the other is triggered and then the hormones are released. Okay, this is how this happens. The hypothalamus is the main. It is present in the brain, below the brain, a small area. It is the main center where all the it triggers all the hormonal release. Hypothalamus triggers the pituitary gland, which secretes hormones. We'll get into the not very deep into the subject, but then the follicle stimulating hormone and the luteinizing hormone, which are released for the well-being of ovary. And when they are released, or on the 14th day of the cycle, there is a surge. Okay, it reaches to a level where ovary gives out the egg, the ovum, which comes out, and then if there is fertilization happening, if there is a sperm, the ovum and the sperm, both of them meet and then the fertilization happens. When this is not happening, the ovum, only the ovum comes and then it stays, and because it is not it is a foreign body, after a little amount of time it is expelled out of the body. This is the physiology which is happening in the body. This is how the hormones act, and to keep it in check, food is necessary, as I told you. Also, I prefer on stressing on yogasanas, pranayama, and I insist every lady, please take some time out for yourself and make sure that you do Surya Namaskara or some important yogasanas and pranayama. Pranayama is very essential in keeping your hormones in control. It is said, naso hi shirasodwaram, that is our nose is the entry point to the head. And as I told you, pituitary is the main area where all the hormones are stimulated. It stimulates the other hormones. So yes, so once we start doing pranayama, nadi shodhana pranayama, and Chandrabhedi pranayama, we have many types of pranayama, which Celia spoke about yesterday. Yeah, when that is done, there is a study which shows that the breath which we take, that is rhythmical breath, and then it also affects the release of hormones, timely release and sufficient release, as much as required for the body for triggering one another. So that is how it is essential. So I insist on doing pranayama, surya namaskara and yogasanas. Now coming to menstrual disorders, the first thing I would like to deal with is very common dysfunctional uterine bleeding, which is seen once upon a time, as my sir always used to say in Pune, that DUB was seen once upon a time only in ladies who are nearing the menopausal stage, that is nearing 50s. Okay, but today, could be because of lifestyle, could be because of any reason, it is seen even in the girls who are in the reproductive age, who are not yet pregnant, unmarried, or had pregnant, pregnancy, have babies, and then also it leads to dysfunctional uterine bleeding. The medical science always tells that there is no essential cause of DUB. That is why it is called dysfunctional uterine bleeding. We have Rakta Pradara, which says that when there is more pitta in the body, there is more, Rakta is pitta. When it increases, the dosha which I told you, Vata, Pitta, Kapha. So pitta is a dosha which is increased when you take a lot of spicy, hot, and pitta increasing kind of food, because of which it increases the Rakta dosha. Rakta is a blood element. I would not say it is exactly blood, but it is a blood element which also is increased in the body because of this reason, because of our food and all the daily routine that we do. And yeah, I will do that. I will highlight all the yogasanas that have to be done during menstrual period. Yeah. So when the blood element is increased more than what is required in the body, it comes out in some or the other form. So during menstruation, when there is excessive bleeding, okay, we take it as Rakta Pradara, dysfunctional uterine bleeding. But as medical science states, we don't have the usual cause of it. There are types of dysfunctional uterine bleeding. Menorrhagia, metrorrhagia, all these are pushed into under dysfunctional uterine bleeding. There is either proper, the cycle is proper, that is, as I said, 28 days cycle is proper, and also the number of days a person has menstrual period, that also is cyclical every month. That is menorrhagia. But what happens here, she bleeds more than what is normal. She bleeds a lot. What is the normal quantity of blood? It should be around 50 ml in the entire cycle. That is 3 to 4 pads a day. But in DUB, she has to change her pads once in every 2 hours. This is the amount of the frequency of the bleeding she has in dysfunctional uterine bleeding. Therefore, menorrhagia is the one where there is cyclical bleeding, and metrorrhagia is the one where there is no much gap between the 2 cycles. The bleeding happens even between the cycles. So all this we take under Rakta Pradara, and we treat the Pitta and Rakta Dhatu, and as per the Prakriti of the patient. And after that, let us talk about hormonal disturbances. When there is hormonal disturbances, we see diseases like polycystic ovarian disorder. What happens here is, this is again a metabolic disorder. This will be this was dealt in metabolic syndrome, even in the last session I spoke about it. So in polycystic ovarian disorder, what happens is, the body, in a female body, androgens are increased. They are the ratio which has to be maintained between the estrogens, progesterone, and the androgens in the female body is imbalanced, because of which what happens is little characters of what do we say, the lakshana characters, as I said, symptoms start, like there is facial hair, and also there is an ovulatory cycle set in. Okay. Because of less hormones, what happens is the follicle which has to rupture, which has to mature and rupture, it is not stimulated, and then it remains as a cyst on the ovary. And because of this, there are multiple cysts which are formed on the ovary, and there is no ovulation, and this becomes a problem where obesity also sets in. And because of this, the girls also suffer with diabetes. They also have acne, a lot of acne, as I said, hirsutism, that is called, facial hair increasing. And there are later depression could be because of obesity and all the other factors which we spoke about obesity the last week. Also there is infertility problems which happen in the later stages. So the main cause due to which this is happening has to be treated. That is, as I just spoke about, it is one of the metabolic syndromes. So food is the main thing where correction has to happen, and the entire vihara, we say, that is the entire regimen of the day, also has to be checked. As I said, yogasana, pranayama, that will be underlined for everything. But apart from that, we have Ayurveda has wonderful medicines, wonderful drugs, where we treat as per the prakriti, the body constitution of the patient, and vikriti, that is the changes which are happening in the body. Considering all this, we assess the patient, and then we have wonderful medicines where we can treat them, right? So PCOD is one of the burning topic which I wanted to cover here. And apart from PCOD, yes, stress is a very, very common factor. Less sleep is a common factor which play with the hormones in the body. The physiological process is disturbed because of stress and improper sleep, food, as we spoke already. Apart from this, DUB we have just done with. Next, thyroid disorders is one of the reasons why irregular menstruation happens. Thyroid disorders will be extensively dealt with by Mr. Rajan tomorrow. He's our nutrition expert who's going to talk about thyroid and the diet. So let us just see what happens in your body when there is excess hypo or hyper secretion of thyroid hormone. Okay. Hypothyroidism is the underactive thyroid gland, and hyperthyroidism is hyperactive thyroid gland, you can say. Okay. And what are the symptoms that we see when there is a hypothyroidism and hyperthyroidism? One thing I want to put here is both of them can convert into one another. There is a very good chance that hypo can become hyper and hyper can become hypo, and both of them can be corrected by food and the daily lifestyle. I will talk about food and daily lifestyle because the main part of treatment for Ayurveda is food, ahara, and vihara, the lifestyle regimen. So this is where the correction always starts. Okay. So if you have symptoms like your metabolism is slow, because thyroid hormone is the one where metabolism happens. It helps in metabolism, yeah. So your metabolism is when there is hypothyroidism, and you feel you have ferocious metabolism when during hyperthyroidism. Also weight is increased, rapid increase in weight in hypothyroidism, and in hyperthyroidism you see without a reason there is a weight loss. So this is the difference you find. These are the symptoms which happen in your body when there is a thyroid disorder which is happening. Also in hypothyroidism you see less energetic person, and then depression, and there is cold intolerance and dry skin. Okay. And also in hyperthyroidism, just opposite to what we have seen in hypothyroidism, you see heat intolerance, you see anxiety, and you also see palpitations, tremors. Palpitation is the, like, you feel as if the heartbeat is in your mouth. That is palpitations. All these are seen in hyperthyroidism. Now, how do we treat hyperthyroidism? Same as I said, we assess the patient as per his body, physical constitution, and we have wonderful drugs. We The main thing that we do in this case is we act on pitta. Okay, because thyroid hormone is the one which helps in metabolism, and pitta dosha is the one which helps, as per Ayurveda, in metabolism. So that is where we act on pitta, on the function. Our treatment is based on pitta dosha, and that is where the treatment principle happens. Yeah, now small tips I would like to give. We have covered most of the signs where you should check in and then see the doctor when the. Let us start first with dysmenorrhea. When you have you know very bad stomachache during periods, when you have cramps, that is the entire circulation is concentrated towards the uterus and the abdomen. That is where you have cramps in the legs and cramps in the back, because the circulation there is a little disturbed. That the same blood has to flow everywhere. So once the blood is concentrated in one place, you have a disturbance of circulation in the other place, right? So yeah, when you have cramps, especially in the young girls who have just reached their puberty during menarche, the first thing which I would advise is put hot water bags, on the muzzle. You will have a relief. Another thing which we usually tell in Ayurveda to our patients is hot water and cow ghee. It helps in relaxing the muscles, and also your pain also is reduced, right? Apart from this, during reproductive stage, that is from the time when menstrual cycle starts to the end of the menstrual cycle, that is menopause, I advise all the ladies to check your diet. Take care that you eat less spicy, not very salty, and apart from this, control your carbs. Keep a check on carbs, I would say, not completely end carbs, because it is essential for bodybuilding. Yes, so take care of what you eat. Or focus on doing pranayama. Yeah, I had a question. uh, what yogasana should be avoided during menstruation? I would say the asanas put pressure on the stomach, those should be avoided. Stretchings can be done, and apart from this, also surya namaskar in on a daily basis should be done by all the ladies on a daily. End of our topic. We at Ayurveda are very happy to see the cases at a physician. All that I just spoke of is at a physician level, not a gynecologist. You identify any of the symptoms which we spoke in the previous session, hesitate to go see a doctor. Don't shy about talking about your menstrual problems. Very essential that you see on time so that it doesn't progress to a worse level. Right. So we at Ayurveda are always happy to help. Contact if in case of any problems or any kind of help you require. So I open the forum for questions, please. Sorry, Rajanji. I guess it is because of the internet. I'm sorry. I'll have to check it. I'll check my internet. Any more questions, please? Yeah, seems like we don't have questions anymore. Thank you so much for seeing, following our daily sessions. We'll have more interesting sessions. Please log in every day at 5 p.m. or at 8 p.m. as we notify. Thank you so much. Take care. Have a good day.